Let's bring in Chief Executive Officer of Heartland Alliance, Bartholomew Ochonye, who joins us now for more on this development. Find the missing millions is the theme for this year's observance. The need to identify the millions of people who have hepatitis but are not aware of it. We're told in Nigeria alone there could be about 15 million people who are infected but are unaware. You talked about policy development. Can you break it down for us as a means to address this?
Yeah, actually that number is 18 million because for viral hepatitis B, it's 16 million, and for viral hepatitis C is 2.2 million. And that's very critical for the national response because viral hepatitis, there are various ways by which it is spread across the country, and the level of awareness is still very low. And that requires a lot more work with communities. You know, beyond health sector, there is need for civil society organizations, community-based organizations, to be more involved in awareness creation and also promoting access to diagnosis, prevention, and treatment options.
Are there peculiar symptoms people can look out for as warning signs of a possible infection?
So absolutely, there are warning signs, but the challenge with hepatitis, viral hepatitis, and that's why sometimes, especially for viral hepatitis B, it's called the silent killer, because by the time you realize that you're already having signs, it's obviously too bad for your liver, as it were. But definitely, the signs include, jaundice, which has to do with yellowish coloration of the body as well as the eyes. Of course, it includes headache, some kind of fever, vomiting, diarrhea might be associated, and so on, yeah.
So WHO aims to reduce new infections by 90% and deaths by 65% by 2030. Would you say as a nation we're keeping up with that pace?
I think we seem to be putting things together to be on track as far as 2030 is concerned, but there has to be more concerted efforts, because even for us to get policies in place, it took us between 2014 and 2017 to have policies in place that would guide implementation of viral hepatitis interventions in the country. And you will agree with me that even some of these policies are not well disseminated across board. There is need for more collaboration with primary healthcare development agency, with community organizations, and there is need for treatment costs, in terms of testing and treatment, because there's need for that cost to be reduced. There is need for more training for the healthcare providers, and there is need for more funding as far as hepatitis intervention is concerned. The National Health Insurance Scheme, state health insurance schemes need to be more proactive in integrating, treatment for viral hepatitis, especially B and C, in their packages. Otherwise, 2030 will be a mirage, because there is also a milestone for 2030, and that is reducing new infection by 30% and reducing deaths by 10%. And like you rightly mentioned, if we still have a burden of over 18 million in 2020, then, 10 years from now, we need to work harder if we want to achieve those goals.
Chief Executive Officer, Heartland Alliance, Bartholomew Ochonye, thank you for talking to us tonight.
Thank you so much.